My sort of first memory of it was being there as a nurse with 30 patients, all sick, in a line out the door waiting to be dosed with methadone.
It was quite frustrating because I didn't know how to deal with these men and women. There was a lot of guilt. I didn't know how to provide the best care, and a lot of blame. And I'm embarrassed to say that I often blamed the patient rather than me understanding what was really happening.
It is a disease like any other disease, but unfortunately, it is not treated like any other disease.
It was not uncommon for me to hear doctors talking about patients as crazy or addicts or things like this, and realizing that there was a lot of stigma within my community, the medical community. We have to really start having open, honest conversations within the field of medicine about how we are understanding addiction in the first place.
Addiction is a chronic medical disease, a disease of the brain. It is not a sign of moral weakness or failure.
It truly is possible for all of us to develop this disease, which is what makes it so scary.
Once I started to understand the neurobiology, that there was a way to actually understand what the drugs were doing in the brain, then it was much easier for me to treat them and relate to them.
Particularly for opioid use disorder, we have excellent medications that are available, and that has to be the foundation of treatment. We need high quality, evidence-based behavioral treatment.
In opioid use disorder, medication-assisted treatment has been shown to have great benefits. People realize that medication-assisted treatment is safe, that it's reliable, that it makes a difference.
I have changed tremendously since working with this population. Despite the fact that patients are very high risk, it's very rewarding on a daily basis.
I see them doing well, putting their life back together, being able to get back to their baseline, being able to support their families, being able to take care of their mental health, being able to get back into treatment. That really inspires me.
Their recoveries are just as compelling as the recoveries that take place in a cancer center or in a burn center or in any other traditional medical facility. I think I've had the benefit of really kind of going on the journey with them towards recovery.
For every intervention that you do with a person, you are having a direct impact on their loved ones and their family. For everybody who doesn't die unnecessarily, that's one more child that still grows up with a parent, and that's very moving and gratifying.